So this lecture is on the skull bones and the landmarks. You actually have to know there are a lot more landmarks that are in the skull and on the bones of the skull that we are not doing. So if you're looking at the pictures in the book and you're thinking it's overwhelming, watch this and see if it helps, because there's many fewer than you will fear. So skull bones, there are 8 cranial bones. Now some of them are paired. We have one frontal bone, 2 parietal bones, 2 temporal bones, 1 occipital bone, 1 ethmoid bone, and 1 sphenoid bone. I've noted the sphenoid bone is called the keystone of the cranial bones. That means all the other 7 bones connect to the sphenoid. It holds the skull together, or the cranium together. The facial bones, there are 14, but again, we have a lot of paired ones. The maxilla has 2 of them, and I've noted that they are the keystone of the facial bones, meaning that all the other facial bones, except the mandible, all attach to the maxilla in some way, shape, or form. We have 1 mandible, 2 zygomatic, 2 inferior nasal conchae, 2 nasal bones, 2 lacrimal bones, 1 vomer, and 2 palatine bones. So let's start looking at the cranial bones. This picture is of a skull from the lab. Just to show you the visible cranial bones. The frontal bone is anterior, and here's the separation. Come on, there's the pen. There's the separation for the frontal. And then we have 2 parietal bones. On the other side, we have the occipital bone posteriorly, 2 temporal bones, and then this small space here that I've fully circled is the sphenoid bone. The sphenoid bone actually goes side to side in the skull, and so we only see a small amount of it on the outside, and we cannot see the ethmoid bone from the external at all. To see some of them, we have to go inside this cranium. So we take off the top, which is called the calvarum, and we look at the inside of the cranium. And we see that the ethmoid bone is kind of a rectangular shaped bone embedded into the center of the frontal bone. Now in lab, I had a model that looked like a solid block of plastic. In reality, this photograph from your textbook shows that the ethmoid bone is very airy. It's got lots of spaces. We're looking at it when we do the landmarks. This point here is the crista galli. So crista galli, which is the point. These lower portions are in the nasal cavity, but you can actually see the ethmoid bone. And I also took a photo of the sphenoid bone from the book. I tried to draw in with the green pen the side-to-side nature of the sphenoid bone. In class, I used that painted skull. The key with the sphenoid bone is it actually does connect all the way across. If you look at the model or in the book, you'll see it has lots of its own landmarks, but we're just going to go with the sphenoid for that bone. There are 4 named sutures, and this page is a description of each suture. The sagittal suture basically runs in the sagittal plane and connects the 2 parietal bones in the superior aspect of the skull, so it's right on top of your head. The coronal suture is also called the frontal suture. It runs in the coronal plane and connects the parietal bones to the frontal bone. Imagine wearing the coronal means crown. Think about wearing a crown. The squamous suture, sometimes written squamosal with an AL on the end, connects the parietal bones to the temporal bone on the lateral surface. The lambdoidal, sometimes just lambdoid suture, connects the parietal bones to the occipital bone on the posterior skull. So let's look at each of those individually. The sagittal suture, I took this photograph on the left side of your screen in the lab with that skull. What is very hard to make out is this back and forth squiggle that is the sagittal suture. It's in the sagittal plane. The artwork shows it on the right-hand side, where we're kind of interdigitating the 2 bones together across the superficial surface of the skull in that plane. The coronal suture is also called the frontal suture. And again, we're bringing it down. It kind of zigzags back and forth. It's also in the artwork. It can be called either name. So there's that suture. And the squamosal suture or squamous suture is this one going across the side of the head. Squamous means flat. This has to be very flat and smooth because there's a muscle that attaches across it. So that's why we have the squamous suture between the parietal and the temporal bones. And finally, we have the lambdoid, sometimes lambdoidal suture. It's named because it looks like the Greek letter lambda, which is sometimes written with the little tail up, so it even has the tail where it connects to the sagittal suture. It runs across here. And one of the things I was pointing out in this lambdoid suture are these sutural bones. Now, those are irregular. They're just little tiny bones that have their own little primary ossification during development. Sometimes they're called wormian bones because they look like little worms in the sutures. You can see even on this skull model, we have little sutural bones. They can happen in the lambdoid suture. They can happen in the coronal suture. They can happen in any of the sutures, actually. They're more common in the lambdoid and the coronal suture.